Howdy, Dwight here with Day and Night Medical Supply. Wanted to take this opportunity to thank you for trusting us, for helping you in this time of need where you need help with your sleep. I want to talk to you today a little bit about what is sleep apnea, what is CPAP, and how will it help you. So that's what we're going to discuss. And the first thing being, what is sleep apnea? Sleep apnea is one of a myriad of sleep disorders. It's by far the most common sleep disorder. It has two primary variants. One is called central sleep apnea, and that's pretty uncommon. And then we have obstructive sleep apnea, which is by far the most common form of sleep apnea. Apnea means without breath. So a patient suffering from sleep apnea literally has periods of the night where they're not breathing. Those periods are at least 10 seconds long, and it's not most of the time not that they're not trying to breathe, it's that they can't because the airway has partially or completely collapsed, restricting their ability to breathe. Now, this has a negative impact on their cardiovascular system, among other bodily functions, so it makes life very miserable whenever they wake up because they're not experiencing restful sleep at nighttime. There's a gold standard in treatment for this, and that's called CPAP. CPAP stands for continuous positive airway pressure. It is important to understand that CPAP will only treat obstructive sleep apnea, and it can actually make central sleep apnea worse. But once again, central sleep apnea is very uncommon, so it's unlikely that that would be a problem that you're suffering from. CPAP uses a mask coupled with a machine to deliver a consistent, small amount of pressure to hold the airway open and to allow natural breathing to occur. CPAP's not a ventilator. It's never going to breathe for you. You are in control. That's important to remember as you start on this journey using your CPAP machine. The way it helps you is by alleviating your obstructive sleep apnea and allowing your body to return to the natural and normal functionality of sleep. Sleep does some amazing things for our body if we let it, but we do a lot of things in our lifestyles and with our health concerns that make it where sleep doesn't do what it's supposed to do. So what CPAP does is it helps return us to that natural state of sleep. Many patients see results on the very first morning and describe waking up feeling absolutely amazing. And I pray that's the results that you receive, but don't be discouraged if you don't wake up feeling that way. It's not incredibly uncommon for patients to say they didn't feel any different at all in the first morning. Where we do pretty much universally see a difference is in the afternoon. So the first afternoon after someone uses CPAP for the first time, where they would normally feel very lethargic after lunchtime, they start to see that, wait a second, I'm not tired, and I don't need to take that nap, and I'm not feeling that overwhelming pressure of sleep. And that's a great thing. That means that the CPAP is working effectively. The most important thing to remember is that you have a support group, and that's what Day and Night Medical Supply hopes to be for you through the years that you're using this device. We're here to help you. We're here to help you with understanding cleaning the device, replacing the parts, how your insurance will pay for parts of it, and in some cases they'll pay for all of it. It just depends upon your specific insurance policy. So don't forget that you have us here to help you, and don't hesitate to call us. We're always happy to help. It's what we love to do. That's why we're here.